course. I'll go ahead and share the slides here. And I can just give a brief intro. Hello, everyone. Thank you so much for joining us for the MCT2D Learning Community event. Today, we're going to be talking about social determinants of health and giving a health equity update on MCT2D. My name is Laria Young, and I'll kick us off. And then I'm very excited to turn the presentation over to Sarah Kyle, who's joining us. She's the Director of Community and Partner Engagement for Michigan 211. She'll be talking about this amazing resource for helping to connect patients with support. And then Jana Foster, who is an RN care manager for My Michigan Frankenmuth, is going to be speaking a little bit as well about the work that her practice is doing around screening patients for SDOH and some of the really innovative, cool work that they're doing to help, again, connect patients with resources in the community and make sure that their needs are met. So I'm going to turn it over to Jackie just to talk briefly about CME and a new sign-in procedure, and then I'll take back over.
Thanks, Laria. Okay, so you'll see on the slide here that to receive CME and CE credit, you have to text 71199 to the number on the screen. Though if you miss that and don't text the number, you can still get CME too. There's a link that'll be sent to you in the handout that LIFA will send following the meeting, and you need to just complete the evaluation online by September 3rd to get that credit. Next slide. And then for this presentation, we're offering medicine CME, nursing CE, pharmacy CE, and dietetic CPEU. 1 credit for each of those. Next. And as far as our disclosure, Dr. Ashman, who's a co-director of our learning community events, has stocks in the following pharmaceutical companies listed on this slide. Next. And then finally, everyone who wants to earn their physician level learning community VBR for attendance for this meeting, we will ask you to do a sign-in following the meeting as well. So afterwards, LIFA is going to send out an email to everyone who is on the call right now with just a very brief sign-in link. You'll type in your first and last name, and then your PO in practice will automatically populate. And when you enter your Zoom name, make sure that it looks exactly like it does on the Zoom screen so that we can make sure to capture that. And yes, I will go in and put the phone number and the code in the chat for everyone for that CE credit. And with that, I will hand it over to you, Laria.
Great. Thank you, Jackie. So like I said, today I'll be giving a short, about 15-minute update on health equity work at MCT2D. I'm then going to turn it over to Sarah Kyle to talk about 211. Jana Foster is going to speak about her practice's experience with SDOH screening and referral. And then we'll have just a few minutes at the end for wrap up and questions. We will pause after the 211 presentation as well. If anyone has questions, please feel free to put them in the chat as we go though as well, and then we can make sure we get them addressed. So diving in just a little bit to give you an update on health equity at MCT2D. We've been really working to expand this work around social determinants of health, and all of this work is part of sort of a broader health equity effort and health equity work that we're doing at MCT2D. So before we dive into those more specific ways to address SDOH needs with our following presenters, I wanted to just give this quick update to share with you all the work that we've been doing so you can see how this fits in, and let us know if you have other questions, ideas, or other ways you want to participate in this. So these are some of the examples of work that we've completed to date, and I want to talk about a few of them just briefly. One of the first things we wanted to do when we started this work was to develop a health equity vision and health equity goals that would help align all of this work we do, not only around SDOH, but other issues with health equity. And we started by reviewing feedback from our practices, from our patients, from our POs, and asking them where they wanted us to focus, where they saw gaps, and what would be important to them. So, and after doing this, we were able to come up with a health equity vision, which I have here, which is that we envision a Michigan where all individuals have equitable access to the best care for type 2 diabetes, regardless of race, ethnicity, socioeconomic status, insurance coverage, or geographic location. And from this vision, again, with your feedback, we were able to develop 6 goals. 3 of this are internal to our coordinating center team and our staff, and 3 of which are sort of external and for our collaborative as a whole that we'll be working on. And so as you see this work progress, we may reference back to some of these goals. And we just have a short presentation today, so I'm not going to go into detail as what these are, but you can learn more about them if you are interested. We have a one-pager that's available at mct2d.org/health equity, and Jackie's going to be putting a link in the chat that goes to this one-pager as well that has a more detailed description of what each of these goals are. We view these as just a starting point for this work, so please let us know if you have additional ideas, things that you want to make sure are included that we consider. Let us know so we can take that into consideration. Whoops. Okay, so moving on, last year we spoke to our POs about what was important for them around health equity. And they told us that addressing insurance barriers and insurance gaps was of the highest importance and the place where they wanted us to start as a collaborative addressing these health equity issues. And we heard this from the rest of the collaborative as well. We heard that coverage was really the biggest barrier in many cases to providing patients with equitable care around diabetes. And so we know that this is a very complicated thing and it takes a long time to make system-wide change. So to start out, we wanted to just try to reduce as many barriers to finding out what coverage was and getting patients coverage for their care. And one of the big parts of this was the launch of the MCT2D coverage checker, and Jackie's going to put a link to this in the chat as well. And this really focused on helping providers understand coverage around CGM. It was a digital version of our print guide. We've now expanded that from commercial plans to also include some Medicaid, Medicare plans, and we will continue to expand this. And we just finished a workshop and are getting ready to launch the second part of this, which will focus on medication coverage and trying to help physicians navigate medication coverage. So this is something we're really excited about. We hope it's a useful tool to you. And again, it's just we view it as one step in this process to try and make health insurance coverage easier, quicker, and better. We also this year had some big coverage wins so far, with Blue Cross Blue Shield of Michigan expanding their coverage of CGMs for MCT2D and PDCM physicians. And this change builds on other coverage improvements we've made as a collaborative, including those to Blue Cross Complete and United Healthcare CGM criteria. And we're really excited that this, and along with the collaboration with ADA to expand coverage for type 2 diabetes with Michigan Medicaid, that we've been able to make some direct system change to healthcare coverage for type 2 diabetes. We also have been updating our tools and resources. Some of these may be familiar to you. If they're not, they are all available for free on our website at any point in time. These include developing culturally relevant tools like specific cultural meal plans. Here you can see an example of our Hispanic meal plan, as well as celebrating food diversity around low carb foods and helping to translate meals to lower carb versions from a variety of different cultures. We also really wanted to focus on ensuring we have resources for patients from a wide diversity of socioeconomic statuses. So this includes an update to our insurance coverage worksheet, things like our dollar store roundup, which is available on the Jumpstart website for low carb foods, and updating tools like our medication copay savings card program. We also are working on adding translations for a variety of these key tools. So these are two that we flagged, that insurance coverage worksheet and the benefits of newer medications, starting with translations in Spanish and Arabic. We would love to hear from you if you're interested in having others of our tools translated or translated into different languages. Please feel free to email us or even put in the chat today if there's something you're really interested in seeing that you think would benefit your patient population. We also have been continuing to develop our partnership with MShield. For those of you who may not be familiar, this is another CQI specifically focused on health equity. And as part of this, we offered one-on-one SDOH consultations for our practice. And during one of those meetings, our practices raised the issue of helping patients understand why they are being screened for social determinants of health. They told us that a lot of patients were saying, you know, why are you asking us all these personal questions? Why are you asking me about my personal finances? And so they requested a clinic poster that they could hang when patients are waiting in the waiting room or even filling out that form that would explain to them why they were being asked these questions. And we made this poster. We had our patient advisory board review it and give feedback on it, which was really great. And then we made this available at our collaborative wide meeting for our POs to collect. And we are planning to open up poster ordering again in the fall for you to request these 4 practices if that's something you're interested in, along with the other posters we developed too. And lastly, we ran a workshop with all of our POs during the collaborative wide meeting to help us answer this question of how might we use health equity data to improve type 2 diabetes care at your PO. We do know that we're getting SDOH data soon, and we want to make sure we're prepared to make this data actionable for you. And so our POs worked through this workshop to answer some questions about what challenges with health equity data, like social determinants of health, were, and provide us with ideas for trying to make them more actionable. And so you can see some of those things here, things like having disparate EHRs, issues with access and reporting that existed, concerns around patient privacy and missing data, things like zip codes. And then suggestions from them. So thinking about ways to improve how they're able to view that data, improving communication between the different entities involved in this data sharing, and looking at addressing issues really at a county or even regional level rather than at a direct practice level. We also asked them to create these prototypes or mock-ups for us of what they would want to see from a health equity dashboard that would really actually be actionable from their perspectives to make improvements in patient care. And so they gave us back all of these examples, and I'm really excited that we are now working on designing a health equity dashboard that incorporates social determinants of health data. And we're going to be starting with Michigan medicine data as a test case to make sure this works and get feedback on it. And then we are hoping to roll this out to the collaborative as a whole as an enhancement to our dashboard 2.0. So lastly, as we continue this work, we really want to have involvement from our practices and our participants. So we are launching the Health Equity and Advocacy Work Group. This work group we're planning to start out really tackling those coverage issues, as this has been something raised both by our patient advisory board and our practices as a key issue. And we are going to be starting this officially on Wednesday, October 2nd from 12 to 1 p.m. And then we'll be running it every other month, that first Wednesday of the month. So there'll be 6 meetings total per year. We are inviting members of our practices again, POs, as well as our patient advisory board, and other people who are interested in joining to come join us. This will be our kickoff meeting. And then we are going to be looking for ways to sort of offer synchronous for people who are able to attend the meeting and asynchronous ways to be involved in making change around health equity and insurance coverage. So I think Jackie's going to put a link in the chat that will take you to a Zoom registration form, or you can scan the QR code on your screen, and that will take you to the registration form for that first meeting if you're interested in attending. And like I said, please let me know if you have any questions about this at all. Feel free to put them in the chat or reach out to us via email. I'm happy to help with that. So with that, I'm very excited to turn it over to Sarah Kyle. Again, she's representing 211. And Sarah, you sent me your bio, and I really want to read it because I was really blown away by your bio. So you have so much experience. So I'm going to go ahead and read this here. So Sarah Kyle is the Director of Community and Partner Engagement at Michigan 211, where she proudly serves all of Michigan to make 211 more accessible to the most vulnerable among us. Having led a 23-county 211 center in Northeast Michigan, she is known for her ability to collaborate and bring people together. Currently, she uses her talent on the leadership team for the National 211 Steering Committee. Sarah has spent her entire career focusing on public health promotion and activism. She is a lifetime certified trainer and consultant for Bridges Out of Poverty, where she takes pride in promoting respect and equality for those who are struggling with poverty. And as of November of 2022, Sarah was elected mayor of the city of Gladwin, where she has previously spent 5 years as a council person. So I'm really, really excited to have you here today, Sarah. And I will end my screen share and turn it over to you.
Yeah, thank you. It's always that hesitancy moment when I ask for your bio of like, do I really want to share this? But thank you for reading it. I am very proud of the work I've gotten to be able to do in Michigan and nationally for the people we serve. So huge thank you for having me. There will be, we'll put the slides and the chat. Y'all can find ways to get a hold of me. Please stop me if you have questions as we go. It's so much more interesting. If you have the question, I'm sure we all do. Thank you, Jacqueline, for taking the slides over. I didn't realize I was going to be on my laptop today, so I don't have like 15 computers. So thank you. Let's go to the next slide and let's jump right in together of what 211 is and how you can use it as your resource. So very, very basically, 211 about 6 years ago was designated by the FCC as the 3-digit phone number for information referral for public services. So we have gotten a little bit more specialized really over the past 25 years. Health and Human Services in Michigan, we are under the Michigan Public Service Commission, so there's no stealing our logo on the down low. Steal it. We're a public service in Michigan. You can't go wrong. What I would say is please don't have people call us instead of 911. So we'll go over 911 in a minute, but 211 is public service in Michigan. In Michigan, there are some qualifications that we have to be a 211. So we are nationally, every center in Michigan is nationally accredited and has been since the beginning. To be nationally accredited, that means we also have to have nationally trained and certified staff providing our services. So a good majority of Michigan, folks who are working in Michigan at 211 are nationally accredited, and almost all of them are at least on a plan for national accreditation. We are very proud of our service in Michigan. We have 7 individual contact centers. In Michigan 211, which is where I work, we get to support each contact center. So if you want to know more about where your contact centers are, you can go to my211.org. But it's important to know you can get a hold of us in many ways. If you go to the next slide, you'll see that we have really, if there's a way to get a hold of 211, it's here. Still, the vast majority, and I mean vast majority, of our contacts come from the phone. When folks are in crisis, it is not as easy as it seems to figure out the quagmire of going online and searching, especially when you're in crisis. So we have phone options, which is just picking up the phone and dialing 211. On all of our promotional material, you'll also see a 10-digit phone number to make sure folks can get a hold of us, because we do get, what is the phone number for 211? We get that question quite often. So the phone number is 211. If you have a virtual system that does your phones, if you have an IVR system, your tech folks do need to program in 211, because typically the only 3-digit phone number that's programmed into computers or into the phone lines right now is 911. So we do have 10-digit numbers in case you haven't done that yet with your tech department. We also have a zip code. You text your zip code to 898-211. So we do have a texting capability. This is national. Most of the time it's not a 24-hour service through texting, but in Michigan, for the most part, it is. But you would text your zip code to 898-211 or TXT211. Also, additionally, we have our directory almost completely available online. The only time that a service may not be available to search online at my211.org is if the organization does not want to be listed on an online directory. As you can imagine, there are some very small organizations who don't want to be listed. For example, they may be a nonprofit where their most common contact information would be a phone number run by a volunteer. So they may say, we don't want that information out there for the general public. But in the vast majority of cases, if you go to my211.org, you can search our directory online. If you serve more than one state, you can go to 211.org, which is a United Way worldwide website, and it'll get you to your local center. You can also, at my211.org, chat with a service provider at Michigan 211. If you go to the next slide, one of the really just cool things about our work is we are integrated in with your 211, in most cases your 911 in your community. So 988 is a new service for Michigan. I think we're about 2 years old in Michigan. Michigan was one of the first states that went statewide with 988. If you're not familiar, 988 is the suicide prevention hotline. So those folks who are working with 988, if someone calls 988 and has a social determinant need, maybe they're lonely, they can't pay their bills, the folks at 988 can search 211's directory internally in their own software. So we partner with 988 quite substantially, making sure that their agents have access to our direct. 911 is very similar, although they don't have an internal connection to the 211 directory, but many 911s, because people call 911 when they should have probably dialed 211, many 911s have a warm transfer line where they can literally push a button and get someone from 211 to answer. If not, if you know of a 911 operator, or sometimes it's the sheriff's department, they can call their 211 and set up a connection. So if we can go to the next slide. Some of the things I wanted to make sure that we shared with you all is how substantial Michigan is for data collection and other services. So last year in 2023, we handled about 711,000 requests for help to 211. We handled many more calls because we handled the Michigan COVID hotline. We handled some work that MSHA did in the state of Michigan. But if we're just talking, picking up the phone, we handled about 711,000 requests last year for help. Of those requests, we had 214,751 requests for housing help last year, as you can imagine, and it's quite often the number one request for help is housing. I always say food, housing, and utilities, that's 211's literal bread and butter. Those are the vast majority of our calls. As you can imagine, during COVID, we had a lot of healthcare requests. There were months and years where healthcare requests or requests for help with vaccines, those requests went above utilities and housing, but it's not often and not common. On the next slide, you can see we have done a lot with our directory, trying to make sure that, again, can be used by our partners in Michigan. We want a no wrong door approach. So I could show you some really cool stuff. Like I saw that you guys are doing this beautiful insurance work with your coverage checker. Love, love, love that. That is such cool work, because in Michigan at 211, we also have marketplace navigators where we maintain the call center for a marketplace navigator for the state of Michigan. So anyone can call 211 and actually work with someone who can get them signed up for a Medicaid, Medicare, we're marketplace specialists. It's important to understand, again, we want to make sure that what we're doing at 211 in Michigan is accessible when needed. So the folks at the Kinship Care Resource Center, which is a project of Michigan State University, they recognized they wanted to make sure that their families who are taking care of family kiddos, which is kinship care, maybe it's a grandparent taking care of grandchildren, it's an aunt or an uncle taking care of nieces or nephews. Kinship care is a really growing need in Michigan, so they recognize they want to get services to their families. They don't want to create a resource directory because they already have one. That's what we do for you here in Michigan. So if you go to the kinship.msu.edu, you'll find that they have created a resource center with results from Michigan 211. So when you're searching through their resources, you're also searching without any knowledge that you're searching 211's directory. And that's intentional, right? We just didn't want MSU to determine that they need a whole new directory. We already have that for you. So if we go to the next slide, I'm going to go over just a few examples of all of the work that we're doing with different departments and folks in Michigan. At my211.org/home-visiting, you'll find that what we've done is we've created a pre-eligibility screening tool. Home visiting programs are so beautiful in the state of Michigan, but people don't access them the way that they could potentially. So we worked with the home visiting programs in Michigan to create this tool. If you go to this website, you're going to see two options. You're going to see, let us find a referral for you, or find one on your own. If you find one on your own, they're going to walk through some really interesting buckets of services that are provided in the home visiting space. We worked with their experts to tell us what people would be searching for and what they would look for. You can also let us find the programs for you. And if you go to that website, it is live. So what's important to recognize is they'll ask you a few questions, and then as you go through that website, those questions will populate a more appropriate referral based on the information you've given. And with your permission, you can have your information sent directly to a service. So those home visiting programs can get information from you with your permission, and then they'll reach out to you from there. You can also have your information or have the information for the referral organization sent directly to you as well. So I am going to put in the website is my211.org/home-visiting. The kinship is kinship.msu.edu. Thank you very much for putting that in there. I'm like, okay, I'll get it typed in real quick. Thanks for paying attention and for getting that in there. So on the next slide, one of the ways that we have continued to enhance the work that we do in Michigan is making these social determinant connections, or more specifically in Michigan and all over the country, we're calling it community information exchange. This is where a community comes together to decide that they're going to work together across silos and across barriers to better serve individuals. This is not specifically to healthcare, although most of the time healthcare is involved in this work. It comes from the San Diego team of 211 in California. So an example of home visiting would be someone comes to your house, and actually the programs are vast. So I'm going to give you one example. You may have a specialist who comes to your house and teaches you how to better play with your young person, with your baby, to help with talking and to help with reading. So they have specialists who come into home visiting programs to give all kinds of support to families. Highly suggest, Sarah, that's such a great question. Highly suggest if you have little guys and girls in your home, if you have a kiddo under the age of 1, certainly to go through that home visiting tool, because there's really cool programs. If not, really, Michigan has just some home visiting programs that would just, like, knock your socks off. It's such great stuff for families of little guys. So anyway, if we go back to what's on the screen, the Jackson Care Hub, what they determined was, this was in Jackson County. This is one of the largest still in the country, but they're doing some social determinant screenings. As of this slide, and I believe I created this slide in the spring, the technology company had said that the 511,000 screenings that were completed, social determinant screenings, may be the most screenings any single hospital has done in this way in the past. That's what they told me. I'm going to believe them because I like it. So in Jackson, what they did is they worked with a company called Riverstar. They connected the local community and all the organizations as well as the hospital to resources. So they can do a screening in their hospital or at one of their partners. And when they have a food need, for example, the food resources can show up, and they can be given to 211 if they don't have those specific needs or the agencies listed. So currently they have 34 agencies in that hub who are getting referrals. Yes, you'll get the slides when this is over. If you go to the next slide, one of the really just beautiful programs that we've also set up with the state of Michigan, which has really just developed this beautiful process, is Wise Woman. So Wise Woman is a set of programs in Michigan that really are focused on heart health for women. And these are very often run through local public health departments, not always, but often. So what they determined was they know at the Wise Woman programs that if you are seeking help in that program, folks don't have one need. Very often they have lots of social needs. So they're sitting with these women, they're going through their program, and they find that a lot of these folks have needs that are beyond what the Wise Woman program offers. So now if a Wise Woman practitioner is sitting with their client and they have a food need or any other social determinant need, they can send, with permission of their client, a direct referral to 211, and 211 will reach out to that family member, to that woman, offer referrals, and then they can actually send those intervention information back to the provider, the Wise Woman provider. Additionally, if someone calls 211 in the state of Michigan and they are in need of Wise Woman service, with permission of the caller, we can send their name and information directly to a Wise Woman practitioner who will reach out to that person. So what we've done is created this navigation and bidirectional referral process with this program, very intentionally to serve people in Michigan better. So the last program I'm going to talk about is with My Michigan Health. So I'm so glad that the next speaker is with My Michigan Health. What we did is we started this program, started as a pilot. It was funded from the Michigan Health Endowment Fund to address specifically loneliness in folks who were over 60. So the pilot was, we were going to build the 211 directory to give more recreational services and projects, to populate the directory. And then those who were at My Michigan were over 60 could be screened with very specific questions. I think they had 3 questions they were screening for loneliness. And if they determined that the person was at risk of loneliness, they would get a referral to 211. And by say get a referral, I wish I could tell you all of the technology behind it. I'll tell you one word, it's magic. So this pilot has expanded beyond just loneliness, and any provider who would like to do social determinant screening can do that at My Michigan in Epic. And then they can ask that person, the patient, if they want their information shared with 211. If the patient says yes, then 211 gets information, including what the screening was for. So if they had a screening for a social determinant of like food, transportation, housing, we would get that information at 211. We reach out to the patient. We have a process set up where we reach out 3 times. And with that patient's permission, we offer them information referral. And then once our time is done with them, including a mandatory follow-up, we send information back to My Michigan, to the provider, so that they can know what happened, with permission of the caller, of course. And as you can imagine, we do have some folks who do not want information shared back, and we do have that process set up with My Michigan, so they recognize that obviously the caller is in charge of all of this. So we have found this to be a really great process to fit in with My Michigan, again, inside their Epic. So they're not leaving their systems to go sign into anything else. Everything happens within Epic. So the last slide is my contact information. I did put the PowerPoint of the slides is in the chat for those of you who may, like to see it. But on the last slide, you'll just see my contact information, and I'm happy to take questions here, or if you have any more questions that you would like to see. So if you go on to the last slide, this is my contact information. And I would love to talk more about this work. I love the work that we get to do. But if you forget all about me, if you forget about Sarah, that's okay. Pick up the phone and dial. Like, the people who are answering our calls can get you connected to your local 211 director for a partnership, for information. We have all kinds of great promotional stuff as well, and we can share that information with you. So reach out locally, pick up the phone and dial, reach out to me. I can get information to you. Is there any questions that I might be able to answer now? Hearing none, I'm going to stay on your meeting if that's still okay, so I can answer questions as we go. Or thank you so much for your time.
Yeah, that would be great. Thank you so much, Sarah, for that presentation. Please, anyone, feel free to put any questions in the chat as we go on to the next section. And we will have some time at the end too, if anyone has thought of any additional questions. Thank you, Sarah, as well, for putting those slides in the chat. I tried to keep up with link requests, but please ping the chat again if you're missing any. Thank you again. So our last speaker today is Jana Foster. I know that she was having some tech challenges, so she's joining us by phone. I really appreciate you, Jana, for making this work with all of those challenges you're going through. So Jana is a care manager with multiple My Michigan Health practices. She went to Mid-Michigan Community College for her associate's degree in nursing, and then went on to Eastern Michigan University for a bachelor's in science nursing. She has been a nurse for 11 years and grew up in a small town without many resources. So she really understands the struggles that patients go through when they're not able to find resources to address their needs. I had the pleasure of talking to Jana during one of our SDOH one-on-one consultations and was really impressed by the way her practice was approaching SDOH screening and, again, those other resources they were offering patients. So great that she had a connection already through My Michigan with 211. So Jana, if you're able, I will turn it over to you now to go ahead and do just a brief introduction to yourself and how your practice currently approaches SDOH screening.
Can you hear me okay?
Yes, I can.
Awesome. It's definitely a Monday for sure. So brief kind of lowdown on my position. I have worked with, well, we just switched over to my Michigan. I was Ascension St. Mary's. So I am a care manager for a few of our practices here. I am mainly located in the Frankenmuth office, but I do basically kind of Saginaw County as the offices that I cover. I grew up in a small town, so I actually grew up in Gladwin County, and I live in Midland now. So I do travel a bit for work here to the practice here. With the MCT2D, one of our requirements was to speak on SDOH, and we have a really good process that we follow here at the practices, or try to at least. So we are currently not with Epic. We are on another charting system. We will be transitioning over, I believe, in the beginning of the year to Epic. But we currently have Athena as our EMR that we work with. So there is some kind of questions that patients are to fill out, usually like a pre-check-in. Not all patients do, but the questions that we typically look at for the check-in process, usually the staff or the MAs who are rooming patients see these questions. And I think, Larry, you have those questions if you want to pull them up.
Yep, I'll pull them up for you right now.
Okay, perfect.
So everyone should be able to see now your SDOH screener here on the screen.
Yeah, so there is quite a few questions that we go through, and it's basically asking in the last year if anybody's had any issues with affording medications, healthcare, transportation, housing, if you're feeling lonely, if you're feeling physically and emotionally unsafe at home, work. I think healthcare is also, and transportation are the vast majority of what we ask. The process that we have here in the practice is if anybody answers yes to any of those questions, I work for population health is the portion of the practice that I work for. So we have a social worker that we have on board. So if anybody does answer yes to any of those questions, we send a task to her to further reach out. And there is some further questions that are called the AAFP. I'm not sure if a lot of people know that. That was new to me to learn. So these are questions, I think that I included them in there too. There's just more in-depth questions on if they did answer yes to issues with housing. And it's asking, more in-depth questions, like I said. So that's kind of the process. And if our social worker, determines that they need more assistance with things, she has resources to give, but she can send us back a task. And we also work with care coordinators who are more of the resource portion. So I get to kind of field some of those, and I do lean on my care coordinators quite a bit. So they help with our patients who are needing assistance with affording medications, affording, housing, transportation issues, if they have home needs in the house, like home care or chore providers, if they can't drive, transportation, or any food necessities that they may need. So that's the process that we go through at the practice here. So if the MA finds that, they've answered yes to any of those questions, they shoot us a message and we follow up, further with the patient to see if we can, assist with those needs. We've had, quite a few, barriers to starting that process of some uncomfortability with, MAs asking those personal questions or patients not wanting to answer the personal questions. And we did kind of do a little, scripting with them saying, if a patient does ask that, or, is asking, why are you asking these personal questions? We have them say that, healthcare is based on any kind of need. So if we don't have enough food, or if we don't have enough nutrition, that affects our health. Or, if we don't have transportation, we can't make it to the doctor or our appointments. So it's kind of just explaining further, the effects of those barriers for patients. And usually after you explain that, people are more apt for answering those questions. So we do use a few different resources more regularly. We use 2-on-1. Also, Saginaw has a community resource guide that we usually look at quite a bit. We work with the Center of Hope a lot for like food pantry needs here in the community here in Saginaw County. We do volunteer there a lot with our group, and it's really rewarding to see the impact that just, a small place like that has on the community. Our offices, most of our offices that we have here with my Michigan, and I work for Frankenmuth, Chesaning, Bertrand, and Vassar locations. All of the offices have like an in-office pantry that we provide, and this is just things like laundry detergent, household needs, like soap, toilet paper, paper towel. We have personal care items such as, shampoo, conditioner, body wash, things like that, deodorant. And we also have gift cards that we can provide to patients if, say, they can't make it because they don't have enough gas money, or maybe to offset cost of, they're paying so much for their medications and they can't, buy groceries. So we have that kind of availability to assist with those problems. I think that's about what I have. I am kind of newer to this job. I've worked here for almost 2 years. It'll be in October. So it's just very rewarding getting to talk to our patients and really being able to assist with those needs, especially nowadays. We all are having those issues. So, and being able to have funding and assist. So that's all I have.
Thank you so much, Jana, for sharing that. We do have one quick question in the chat, which is,
Yeah.
Is it all right to share the PDF of the SDOH screener that you sent me? Is it okay to share that with the group?
Oh, absolutely. Yes.
Okay, great. Karen, I will go ahead and upload it in just a moment here to the Zoom chat, and we can share it out after as well, so that you'll have two options for getting that. Jana, thank you so much for sharing all that information. I just was wondering, do you have any sort of tips or things that you felt like worked out really well for your practice for other practices who might be interested in either having something like the pantry that you have with supplies for patients directly in the practice, or for implementing maybe those more in-depth SDOH questions that other practices could, think about if they want to do this as well at their practice?
Yeah. I think a lot of it is just communicating with the staff. A lot of it, I'm kind of in the background. I'm in like a back office. So, I don't always get to be face to face with the patients that are coming in every day. So I think it's just a lot of communication with the staff. And if, some patients don't feel always comfortable talking about it. So sometimes we used to have, or some practices I think still have, just a paper version of those questions. And I think there is also a question on there that asks, if you did mark yes to any of those questions, do you feel comfortable for follow-up? Instead of, just talking about it at that time, because I know I have, it's a pride thing for me, about asking for help. So sometimes that takes that out of the equation. So I do think that that's a good option. And maybe having one person appointed in the office if there is any needs that are associated. So, there's not a lot of confusion on, who should be reaching out to the patient. I don't know if that answered your question, maybe.
No, that was a great answer. Thank you. I will open it up. Does anyone else have other questions for either Jana or Sarah that they would like, or anything else from their practice that they would like to share?
Sorry, is there a way, hi, this is Shruti Ramakrishnan, one of the faculty at Beaumont Family Medicine in Grosse Pointe, or Cornwall, I guess. Is there a way that I could share this recording with my residents as well for resources for their patients?
Yeah, absolutely. I know that we will upload the recording of this to our MCT2D YouTube channel. I think it usually happens, Jackie, maybe about a week after the recording is done. And then you could share that YouTube link with your residents. Would you prefer to have a direct copy of the recording, or will that work okay for you to have the?
If there's any way to get a direct copy, that would be great. We're like the sole residency for the whole program, so I think it'd be a great resource for a bunch of our consultants as well.
Oh, fabulous. That's wonderful to hear. Okay, Robin is also asking for a direct copy. Jackie, is there any issue with that, with sharing the MP4 file from the meeting?
No, not at all. If you can both put your email in the chat, Laria, if we want to send the direct recording, I know it takes a little bit for Lifa to sometimes upload the YouTube one, but the direct one should be ready pretty shortly after the meeting. And then, like Laria said, all of our previous learning community events are posted on our MCT2D YouTube channel. We have a playlist that has this one and a ton of other things that might be helpful for residents or others. We cover a lot of topics that are really, really relevant. So I would suggest checking that out as well. Mm-hmm.
Can I make a suggestion? And I don't know if it's 211 because, obviously I kind of like my, my job. If you would like someone to talk to your group about 211 to make it very specific, I did you can put a time on my calendar. I'd be happy to get someone locally. We're all over Michigan, so I know I might be in Gladwin today. I'm sitting in Lansing. So we could make something specific for you. I also put a link to some marketing materials that are free. So download, put in, newsletters, emails, things like that. There's commercials, quick videos of what 211 is as well. So sorry, I didn't mean to interrupt you all, but we're happy to come out and talk to folks or create something just for you.
Awesome. Thank you.
You're welcome.
No, that's a wonderful resource, Sarah. And I think I even saw you share your personal calendar invite as well, which I think is a great way. I know we use that resource to sign up for a slot with you. So thank you for making that resource available. Jackie, I just saw that some people are having issues with CME.
I can email Jessica Beaumont to see, but like we said, if you use the link that is sent out in the form afterwards, you do not absolutely need to text that number in order to get CME. I think they do it so that it's directly sent to you versus you having to seek it out. I'm guessing it says user not found if you don't have a previous Beaumont CE profile. So we will send out the handout, which will be able to have you fill out the CME requirements.
Great, thank you. And I saw some other questions about getting to have access to the video recording. Ashley, I'm not 100% sure if you would get a follow-up email, but if everyone who's interested just wants to put your email in the chat, we can go ahead and save that and send out a follow-up email that includes a link to that MP4 recording. Kelly is asking Sarah how to sign up for the live sessions with you that you just discussed. Oh, great. Thank you.
I just put my email in there, but also put my Calendly link. So Calendly, I know I'm not promoting anything. You can get a free version of it. And I think Microsoft has something now, but it's just a way for us to put a few minutes on my calendar so we can talk about it. But folks, it doesn't have to be me. Like, we have great presenters, but I'd love to come and talk to you. So I'll put my Calendly link in there, or you can email me at any time.
Perfect. All right. Thank you everyone for putting your emails in the chat. This is great. I will go ahead and save this so that we can send out the video recording. Before we end, are there any other questions that we can answer? Everyone just submitted here. All right. All right. Well, thank you, everyone. I think we're okay with going ahead and ending. The MCT2D team can stay on just a few minutes in case anyone has questions for us, and we'll save the emails that are now in the chat to do follow-up emails. Thank you again, Sarah and Jana, so much for taking the time to speak. I'm really excited, Jana, to continue working with your practice and you as part of the collaborative. And Sarah, I know we talked about additional possibilities for 211 collaboration with MCT2D. So we're really excited to explore that. And thank you so much for your time.
Thank you for having me.
Yeah. Thank you, everyone.
Thank you.